doctor for today to enlighten us on low back pain.
You are welcome, viewers. I am Dr. Buto Gosde, the head of Physiotherapy Department, Federal Medical Center, Asaba, and Director of Complete Physiotherapy Clinic, Asaba. We are looking at the term low back pain. Okay, now we want to know what is low back pain. Most times people get confused to associate low back pain with pain that is in the low back. Actually, broadly speaking, low back pain is a term used to encompass all pains emanating from the spine, or what we call pain of spinal origin. Now, I must make this clarification because there could be some pain that are in the back or in the low back that are not associated with the spine, like referred pain from internal organs could also mimic pains of spinal origin. So when we say low back pain, we're actually referring to pain of spinal origin. It could come from the cervical spine, it could come from the thoracic spine, it could come from the lumbar spine. Earlier in this same program, in this channel, we had discussed about arthritis. And I told you that any pain or inflammation in a joint is simply referred to as arthritis. Now, for that of spine, any pain and or inflammation in the spinal joint is also referred to as arthritis, but the term used is spondylosis. So when you hear lumbar spondylosis, you are talking of pain of spinal origin in the lumbar spine. When you see diagnosis, maybe when you do an x-ray or otherwise, and you hear cervical spondylosis, thoracic spondylosis, they are talking about arthritis of the cervical or thoracic spine, respectively. So arthritis of the spine or pain and inflammation in the spinal joint is referred to as spondylosis. There are other terms used to be able to distinguish the actual causes. Like when you hear terms like spondylolisthesis, spondylolysis, etc., they're actually referring to still the spinal pain, but they're actually trying to delineate the causes. All right, we'll come to that later. So, what is low back pain? It's actually pain of spinal origin.
What are the causes?
The causes of low back pain are multifaceted. They are very diverse, of which this program will not be enough to exhaust all. But I'm going to highlight a few of it. Number one, to understand the causes of low back pain, you will just have a little idea about the spine, how it looks like. The spine actually protects the spinal cord, the spinal bones. The spinal cord passes in between. And the way God made it, there are small bones that are separated by disc to allow some form of movement. Okay, so you have bones, little bones, which we call vertebrae, that are separated by a shock absorber, which we call the disc. Now, those shock absorber, in terms of jumping, in terms of walking, they minimize impact. So they help you to cushion those activities. And because of these multiple joints, you're able to carry out certain movements such as bending, lifting, turning, dancing, etc. And the spine allows. If it is a one rigid bone, you will not be able to carry out. So to understand the causes of low back pain, you have to have a brief understanding of the anatomy of the spine. The spine is made up of small bones that are separated by what I call the shock absorber, or what we call the disc. Now, there are small bones. These bones are called vertebrae, okay? From the neck region to the lower region, where it now joins with the pelvic bone. Now, each of these vertebrae are separated by the disc. The disc acts as a shock absorber. so that when you do all those activities like jumping, like all of them, it will be able to carry out its function, which is primarily to protect the spinal cord. That's one of the major reasons. So let's assume these shock absorbers are not effective and you jump even from a short distance. What happens? It could crack, it could break, it could compress on the spinal cord, and that could lead to a multiplicity of problems. So in order to avoid this, God made in such a way that these bones are separated by this. They are small and separated. At the same time, this joint allows us to do certain movements. So movements such as bending, dancing, you see some people even somersault. It is simply because these bones are made like that and separated. If you had a rigid bone, just one long bone, you will not be able to do that kind of activity. And there are cases, for example, where you might need a surgery that will cause a fusion of this bone. That's what we call fusion, okay? That's the name of the surgery. And once you do that, you will not be able to carry out some of these activities. And that's why it is good to have an understanding of what we are talking about today, to be able to manage your back if you already have a low back pain, and then to be able to prevent low back pain if it is not there, especially if it could lead to this kind of surgery. So let's now go back to the causes. Understanding this anatomy, number one, what are the causes? They also call predisposing factors. Aging. Now, let me put it that there are modifiable causes and they are non-modifiable. When I mean modifiable now, it means there are things you can change. There are things you cannot change. So, for example, aging. You cannot change aging. You must grow older. Now, as you grow older, looking at the anatomy again, this disc begins to shrink. They're actually soft tissues made of gelatinous material, soft tissues with a high water content. With aging, it begins to shrink, it begins to reduce in size, and its shock absorbing capacity begins to reduce. That disc is a major cause of low back pain because sometimes it could become inflamed, either due to injury, infection, or any other cause. And when it is inflamed, on its own, it causes pain. At other times, it may swell because of the inflammation. That's what we call bulging. And when it is bulged, touching the peripheral nerve that emanates from it will cause pain. On the other hand, it could rupture. So I'm going step by step. That's for the disc. Then there are other causes even to that disc. Some form of inflammation such as tuberculosis and some other bacterial inflammation can affect these discs too. That can actually lead to rupture or swelling. But the bottom line is it is inflamed. And that's the type that is referred to as sometimes acute lumbago or prolapse intervertebral disc or disc herniation. We're almost using one term. Different people use different terms for this. They are referring to almost the same thing. But then, if you're a medical personnel, the name actually will tell you the degree. Now, if I say disc herniation, it means it has, not that it has moved out of its position, but because of the swelling, it has bulged beyond its anatomical limit. Now, when we say prolapse, it means it has moved, it has ruptured, and the content has burst out. But the bottom line is not able to do its job. So aging reduces the elasticity of the soft tissues around this joint. The soft tissues including the ligaments, the muscles, the disc. And the funniest thing is, these soft tissues, when you do an x-ray, you're not going to see anything. So most people will tell you, well, I have back pain, I've gone to do x-ray. They say they didn't see anything. Obviously, you won't see anything if it is a soft tissue. And most cases are actually caused by soft tissue abnormalities. So most times you are not going to see anything in the x-ray. So you have aging causes loss of elasticity of these soft tissues. It increases the chances of strain and sprain to these soft tissues. When these soft tissues are sprained or strained because of your activity, for example, abnormal sitting posture, you can put a particular muscle or ligament or tendon to a prolonged stretch, and that could cause strain. Now, abnormal lifting technique, you could lift an object that's actually bigger, okay, the weight is heavier than those particular soft tissue can cope with, and it will cause a strain. It's like having a rubber, an elastic band, and you apply so much force on it. Even if it did not cut, it will be strained. Now, there could actually be a cut of muscle fibers, ligamentous fibers. When there is a cut, there will be seepage of blood. And you may not see all these things in X-ray, and that is more prolonged. It is more difficult to treat. So our lifting techniques, our posture, either in standing or in sitting or even in sleeping. Some people will tell you, I've bought orthopedic mattress. Why? Because when you have some mattresses that maybe your weight is big, you lie on them and it presses down. You are sleepy, you don't even know. So you put those muscles on that side into prolonged stretch. It causes strain or sprain to those soft tissues, that kind of mattress. But on the other hand, some of the mattresses they call orthopedic, personally they are not actually orthopedic mattress. They are just hard foams that people produce and give to you. And you sleep on them, wake up, you have more pain. Why? Because the contours of the body need to be addressed by these mattresses. So if it's also too hard, it is not good. All right, so take note of this. Because of time, I'm trying to go cover everything at the same time. So your posture, whether in sleeping, in lying, in the office, on the road, there are some people that do all this work, like some of these policemen, road safety official, especially those policemen that they are not tired of standing on the road, even if they are not checking armed robbers. They stand for too long, they create a lot of pressure on their spine. That pressure continue to compress on the disc, and most of these people, they are aging already. The disc is already losing its capacity to carry out its function. Then you are putting such pressure. It's like you have a foam, foam, there is water, and you put a weight on it. What happens? The water inside will go off. All right, so it will now become like hard something compressing on each other. And the more you do that, so prolonged position in weight bearing, like in standing, in sitting, is not good. So if you go to the hospital, they will tell you, do not sit for too long, do not stand for too long. That is what they are trying to protect. So let me go back. I'm talking of the causes. I've highlighted aging and how aging affects us. Even I've linked it to all the other areas of position and the rest. Now, what is the other thing is your weight. The bigger you are, I'm trying to use economical with word. The bigger you are, the tendency for you, the more the tendency for you to develop this problem. Because I've explained it. When you are so big, okay, I'm not trying to use the word fat now. When you are so big, the pressure is there because this weight is transmitted through the spine. The spine is the only bone connecting the upper body to your lower limbs, to your legs. So the weight must be transmitted through the spine. And like I told you, each of these small bones will pass on the weight to the disc, to the next bone, until they come to your leg, your two legs. So your two legs now bears the weight, transmit it to the floor. So when you are big, the head, for example, is about 10% of the total body weight. So imagine those people with very big head. Imagine what the spine is carrying. Then the body itself. So the bigger you are, the higher the tendency for you to develop these problems. Then
How is it classified?
this back pain into two, acute and chronic. There are some activities that you just do instantly. Some people just tell you, I was taking my bath, as I bent to lift the bucket, I had a sharp pain. Yeah, acute injury. Okay, I've explained it. You just did something that is not good, that your soft tissue could not cope with. And so you develop this injury to your spine. So that is acute. And if you manage it well, sometimes the acute pain will resolve on its own. Okay, especially if all things are equal, like good nutrition, healthy environment, okay, it could resolve on its own. Or simple analgesics, vitamin C, could help in the healing process. And you're okay, but it's not good to manage it because it can actually lead to chronic. In acute, some people, some authorities actually use time, duration, to define what is acute and chronic. So in acute, they tell you if it is less than this period. In low back pain, it's not like that. In normal pain, they will tell you if it's less than 3 months, it's acute. If it's beyond 3 months, then it's chronic. But any low back pain that does not resolve in 2-3 days is going into chronic. So chronic now talks about the duration and the level of degeneration that has occurred, the level of changes that has occurred. And that now brings us to this other aspect of causes of back pain that people generally classify as arthritis. It's a wrong term, actually, clinically. But then, what do they mean when they say arthritis as a cause of low back pain? They mean osteoarthritis. I know we've discussed that in this station. Osteoarthritis, or the low back or the spine, that defines the changes that has occurred in these joints. Now, what changes are possible? Either due to repeated shear stress, wear and tear, injuries, and otherwise, you could now have changes in the spine, in the joint, because of inflammatory effects. One, you begin to have degeneration of the disc, wearing away of the articular surfaces of the spine because of repeated friction. Then you can have what we call osteophyte, bone growth in response to the inflammation. So there will be abnormal growth of bone. The bones are not supposed to be there. So they began to grow around the spine. It's like when you have injury, a fracture, the bone must heal because there's contact. So it's like a healing process, but it's abnormal because the bones begin, we call them osteophytes. Now when these osteophytes are there, they compress on tissues and even peripheral nerves. And it's not a very good case because the more they are, the more difficult it is to manage. And normally, you may be required to do a surgery, which we call laminectomy, where these things are cut off. And because they are cut off, the chances of growing again is there. So, the importance of having what we call back hygiene is very necessary. Because back hygiene will prevent some of these things. So, arthritis, wear and tear of the spine. So some of the activities we do, we think we are coping, we can manage. You don't know that it is bringing an accumulated insult to that spine. There are some diseases like autoimmune diseases, cases like ankylosing spondylitis. Okay, those are extreme cases. They are rare, but I've treated a couple of them. These ones is not caused by your abnormal activities or otherwise. These are pathologies that emanate from your own system, either because of gene mutation or genetic influence. Now, you have these people, you just have their spine fusing naturally. It could occur in different joints. So before you see, these patients cannot turn their neck. You check and they have pain in different areas of the spine. Could be in the neck, in the thorax, in the lumbar region, pain all over. This particular one, for example, has no cure. You manage it. That means you have to be on physiotherapy for a very long time.
How is it diagnosed? The symptoms.
It's diagnosed. Primarily, diagnosis is by a qualified medical personnel. You can't make a diagnosis. But then you have symptoms that will make you know you have back pain. Number one symptom is pain. The pain could be localized in the back, or it could be referred. You can be feeling it in your legs, in your thigh, front of your thigh, behind your thigh, the calf muscles, your feet. Now, for the healthcare professional, the location of the pain can actually tell us the area where this pain is emanating from. There are some patients, I've seen a patient that was going for a mammogram, that was going thinking it's a breast cancer. Her pain was emanating from the thoracic spine and is radiating to her breast region, the whole chest. Okay, so you could have, but the primary thing is pain, which could be localized or it could be referred or diverse. So you can have pain localized in the back, or it's there and it's also going to other areas. It's a peripheral nerve that transmits those pains. So the first thing you know is you have pain. Okay, some could come and go. That's intermittent. It could come when you wake up. As you move around, the pain goes off. Some people begin to think it's spiritual. No, it's not. It depends on the cause. Like the one we call spinal stenosis. Okay, when the canal where the nerve is transmitted is closing up. Now, in the night when you sleep, the viscosity of the blood increases, so blood flow is reduced. Cold region, blood flow is reduced. You now have this pain. As you move around, the viscosity of blood reduces, so flow becomes better. And all those irritating substances that are irritating the nerve in those areas, those narrowed canals, will be flushed off and you feel free, no pain again. So some people tell you it's only in the night I feel it. When I wake up, that is most times is caused by spinal stenosis. So the pain could be intermittent or it could just be there. The pain's character may also be there, which could be dull, aching, or it could be very sharp. Those ones will tell the medical practitioner the nature and the cause of the pain. Now, I want you to be careful here because you could have pain, like I said earlier, that is referred from internal organs. And most times, we call it a red flag. Okay, it is dangerous. For example, you could have a ruptured spleen and you have pain referred to your neck and your shoulder. And that's why it is necessary to have a qualified medical personnel to examine you and make this diagnosis. For example, pain from a ruptured spleen radiating to those areas must require immediate medical attention. If not, the patient may not survive. Okay? Other pains may be from the GIT, the heart, the kidney. Those internal organs may be referred to the back also. They are not in this class of low back pain. We don't call it low back pain. They are referred pain. So that's why it is necessary. When you have this, if you are not very sure, please visit a medical practitioner. There was a young man that played this a combat sport, and then he just walked to his friend, who is a medical practitioner, and told him, please recommend some drugs for me. I played a combat sport, this American football or rugby, and I had a few falls, and this happened. And the medical practitioner was not careful enough to do a detailed assessment. He just did a normal, okay, take this, and he left. That very day, the young man died. You know what caused it? The spleen ruptured. And he was having a referred pain to the cervical spine and the shoulder. So this is necessary. When you have pains like that you are not very sure of the cause, please go and see a qualified medical practitioner that will assess you and make a diagnosis. So in making diagnosis, I'm not going to go in there because the medical professionals are trained to do that. There may be other things that they may require, but the first thing is to be examined first. Some patients will rush to X-ray, rush to MRI, and CT scan. You know, sometimes they are not necessary. The first thing is a physical examination. Then if there is need, you are now referred to get all those. Those things are a support evidence. Either if I'm not sure or if I want to be sure of what really happened, I may send you for X-ray or any other diagnostic aid that will assist me to make a diagnosis. So the first thing, visit a qualified medical practitioner for the diagnosis. So once you have pain, that's your own diagnosis. You know that I have pain in the back. The next thing, visit a qualified medical practitioner for assessment and diagnosis.
All right, this is Alpha we can go on the program because of want of time. Dr. Gosde Ogbeto is the HOD, Physiotherapist Federal Medical Center, and also the Director of Complete Physiotherapy Clinic, Asaba. Will be back next week to complete this particular topic, low back pain. So, for your questions, suggestions, and sponsorship of the program, reach us via the contact on your screen. I remain Iruru Omoyem. Ensure you go for a regular check for you to stay very healthy. Bye.